Okay, let me know if you need to record the presentation, and I can give you access to record. And if not, we'll certainly have this saved on our Facebook and YouTube pages and channels. Jackson, there you are. Okay. And then we will let Tim Kaufman provide or kick off this presentation. So one moment.
Yeah, Kate, if you can give me the ability to record, that'd be great.
How do I do that?
Is it better for you?
Okay, Tony, it sounds like we are good to go with everyone recording. So with that, Tim, you have the floor.
Thank you. Good morning. Thanks for being with us today. The health and safety of our residents is a top priority as we recover from the COVID-19 pandemic. We know now that the CDC and FDA have recommended pausing the Johnson & Johnson vaccine due to some rare side effects. As such, we've taken precautions today and are here to provide you as much information as possible and as we know right now. Here today is our local health officer, Dr. Gail Minns, and following comments from Dr. Minns, Adrian Byrne, our health director, will have comments as well. Dr. Minns? Dr. Minns, you're muted.
Thank you. As mentioned, the FDA and the CDC released a joint statement this morning saying that they are recommending that all the Johnson & Johnson vaccine administration be paused immediately. This was a result because of 6 reported cases of people who have received the Johnson & Johnson vaccine that have developed blood clots of the veins of the brain within a 2-week period after receiving the vaccine. At this time, there's no proof that it's related to the vaccine, but the FDA and CDC are wanting to investigate these cases thoroughly before proceeding with any additional vaccinations. These blood clot types that we're seeing are very rare, and they're also unusual in that they're associated with a decrease in the patient's platelet count. Now, more than 6.8 million doses of the Johnson & Johnson vaccine have been administered to date. And I want to emphasize, all we know at this point is 6 cases that have been reported. So the vaccine still appears to be very safe, and it hasn't been proved yet that these cases were due to the Johnson & Johnson vaccine. But I want to emphasize these cases are very rare, very rare. CDC and the FDA plan to hold a meeting tomorrow to review these cases. They are stating at this point that this pause will probably be very short, but they want enough time to investigate the cases. And they also want to get out a message to people getting the Johnson & Johnson vaccine and their physicians to know about these cases so that if additional ones occur, they can be identified quickly. In that spirit, they're recommending anyone who's received the J&J vaccine who experiences headaches, abdominal pain, leg pain, shortness of breath, within 3 weeks of receiving the shot to notify their primary care physicians immediately. And they're also going to make recommendations that their physicians need to know that you do not use heparin for these kind of blood clots. An alternative anticoagulant will be needed. Similar cases of this have been seen in Europe in the vaccine that's made by AstraZeneca, but which is not available in our country. They also want to investigate whether the cases between the Johnson vaccine and the AstraZeneca cases in Europe have any commonality or relation to each other. They also want to stress that getting vaccinated is still very important. The Pfizer and the Moderna vaccine have not been associated with any cases like this, And the strong recommendation is to go ahead and get one of those two vaccines while we are on this phase of pausing and using the J&J vaccine. At that point, I'd like to turn it over to Adrian Byrne, who will tell you the response that the county health department is taking in Sedgwick County.
Thank you, Dr. Menz. Good morning. So we had just under 1,300 doses scheduled for today as far as people to come to get Johnson & Johnson, and the same on Thursday. And we are pausing that as the rest of the country. So far this morning, everyone has been very receptive and has chosen to come on in and get the Pfizer vaccine. So we are very happy about that. We are sending emails and trying to reach out to those that are scheduled for Johnson & Johnson to let them know that that won't be available today for the reasons just mentioned, but that we do have Pfizer available for them. And we're outside asking people if they are here for Johnson & Johnson and letting them know. And again, so far people have been great and somewhat disappointed, but still choosing to come in and get vaccinated. And we will do the same on Thursday. So again, we do have plenty of Pfizer vaccine. So if anyone is scheduled for Johnson & Johnson or wanting to hold out for Johnson & Johnson, I would really support you to go ahead and come in. And if you don't have an appointment today or Thursday, we do have other appointments available for Pfizer. So to go online and schedule that appointment.
All right, thank you, everyone. Now I'd like to open the floor for any questions from our media partners. Cake News, can we start with you?
Yeah, it'd be great. My first question is just simply, we've struggled with vaccine hesitancy in the county and really across the U.S. Are you afraid something like this is just going to be gasoline on that fire that's going to make a lot of people who are on the fence, back away from all vaccines? And if so, how do you combat that? How do you kind of work to message this to say, this is 6 million people and kind of try to ease those fears?
I can say from my perspective, and I definitely was concerned when we began talking about this early this morning, that definitely is a possibility. But I've been very pleasantly surprised that those people so far that have been really holding out for Johnson & Johnson just said, okay, I want to be vaccinated. And there's been a couple people that were hesitant and just talked with them about, let's just get one dose and then, go from there. So it's been a positive response here at the clinic because people really have held out for Johnson & Johnson, but are willing to get vaccinated because they want that coverage.
I would confirm that, and I would also add that, again, the Moderna and the Pfizer vaccine have not been associated with any serious side effects, anything like this. They're very effective, and we will investigate the J&J vaccine to determine whether this is a real phenomenon or just a coincidence. But people still need to get vaccinated for the purpose of preventing serious illness and possible death from the COVID vaccine, the coronavirus. And so it's still important to go ahead. We have a safe vaccine. We have two safe vaccines. So it's disappointing we can't give the one shot, but the two shot works very well also.
Anyone from KMUW, our partners with KMUW, have questions?
Yes. Could you tell us how many places the county distributes the J&J vaccine to here locally and about the number of doses that might be on hold now?
Do you have those numbers, Tim? I know that we were giving Johnson & Johnson at our drive-through, had planned on it Thursday, and we've yet to discuss, what we're going to do with that, if we will offer Pfizer or not. But we were giving it here in the drive-through. In regards to partners, I don't have that information in front of me who all we have distributed that to.
And I don't have that information with me right now. I know that we are in contact with organizations that we have some future events planned to let them know that right now we're on pause with the Johnson & Johnson. So we'll either reschedule those events or we'll consider whether or not those events are appropriate for the Pfizer vaccine. We have decided that we'll offer the Pfizer on Thursday at the drive-through for individuals that are still in need of a drive-through option.
There's some vaccination sites in the city that are getting vaccine directly from the federal government, not through the county health department, including the VA and some of the FQHCs. And I'm sure they have received the same information. And I don't know if they're giving Johnson & Johnson vaccine today or not. I don't think they're giving it, but I don't know if they even have it.
And just a reminder that, we had received approximately 5,300 doses. And because of the human error that occurred with the Johnson & Johnson vaccine last week and the millions of doses having to be wasted, we don't know after this week or last week what we received, when or if we would even receive additional Johnson & Johnson prior to this occurring.
All right. And our partners with Wichita Eagle, do you have questions?
Yeah, hi, this is Chance. Are there any, is the use of kind of the backfilling of these Johnson & Johnson doses with Pfizer doses, is that going to complicate any of your future scheduled appointments for Pfizer, or do you have enough open appointments that it shouldn't create a shortage?
We have open appointments and would love to get those filled.
Yeah. So the people that have received the Johnson & Johnson vaccine here locally, Dr. Benz ran through some symptoms people should look for. Is there anything else people should look out for if that are nervous that received the Johnson & Johnson? That should they call their doctor? Should they get themselves checked out or anything like that?
If they're having no symptoms, I don't think there's any benefit of quotes getting checked out. And I want to reemphasize the 6 cases were all seen within a 2-week span of getting the vaccine. Now, that isn't to say it's not impossible to get it further out, but they've all occurred within the first 2 weeks after the vaccine. So my point is, if someone's out beyond that, it's even less likely it's a thing that's going to happen. So again, 6 cases out of 7 million vaccinations. It's very rare.
Chance, any other questions?
Nope.
Kirk, we'll move on to you with the Business Journal.
Dr. Menz, given that 6 cases out of 7 million, were you surprised by the CDC and FDA pause?
I think the CDC and the FDA are trying to be very cautious and very conservative in making sure the vaccine is safe. And I guess I wasn't surprised. I was surprised to hear about it because I didn't know we had these 6 cases, but I wasn't surprised they just paused the vaccination administration because they want to be very certain, and they haven't had time to invest these cases. Until they do, I don't think they're going to be comfortable with going ahead and plus they want to get the word out to physicians that unlike most blood clots where we use heparin, you should not use heparin in these cases. So I think they're being very good and judicious in taking at least a few days to get the word out and get the physician community notified of these cases and what to do if they see patients with those symptoms.
Thank you.
Anyone from our partners with KWCH have questions for our panel?
Yes. I know when the county started administering the Johnson & Johnson vaccine, I know that they were trying to target certain communities in the beginning. Is there possibly one community specifically that has received more of the Johnson & Johnson shots?
No, the vast majority of the Johnson & Johnson that's been dispensed in our community has happened through our clinic site. So that's a general population opportunity. We have used it in some specific instances. We partner with KDHE as they've come down the last few weeks to work with folks at the Lord's Diner. But we've, again, dispensed more through our vaccine clinic to the general population than anyone else.
Our partners with KSN, do you have any questions for us? KSN, do you have any questions? All right, are there any other questions, anyone that I might have missed within this conversation? All right, Tim, do you want to close us out?
Just want to thank everyone for coming today and hearing our message, and just to make sure that the community understands that we're operating in as a safe and efficient way as possible. Dr. Menz has reviewed this information and he agrees with the decision to pause, and we'll continue to monitor information from the CDC and FDA and move forward when we can.
Thank you, everyone. That concludes this presentation. We will have the recordings on our Facebook page and YouTube channel following this, and we will keep you posted with any further updates as we learn more. Thank you.